Hello everyone. Today we're going to talk about organizational management issues in health, disabilities, and aging. And again, as we discussed in our last class, this will be a brief overview to cover some of the main content, and we can discuss in our next class as well. Particularly today we're going to talk about models of leadership, specifically social work leader roles and organizational operations, and sort of typical examples, and describe the specific skills and perspectives that social work can actually bring to leadership that might enhance that role, whether it's in the context of the social work department or set of roles, or whether in a larger organizational or agency structure. Also, we'll learn about challenges that social workers have reported with leadership roles, and specifically in the constantly changing and complex work environments that are typical in health, disabilities, and aging, including hospitals, nursing homes, community practice settings. So when we think about models of leadership, it's important to recognize that the term leadership can actually encompass a lot of different tasks, responsibilities, roles, but there are some styles of leadership that seem particularly common in health, disability, and aging settings, and that can be understood separate from the roles of leadership. So, in other words, these are kind of styles or perspectives in leadership that have consequences for how the work is done. We may think about transactional leadership, for example. This model would promote exchanges between leaders and followers, so it tends to be more hierarchical. There's a kind of a clear lines of authority, and leadership in this model would make decisions, provide direction, and kind of provide a vision for the team or the work group. The second example we might think about is transformational leadership, which is very congruent with social work practice and values. There's an emphasis on inspiring others and motivating followers, so there might in fact be delegation of tasks. You might give people kind of guidelines or objectives or goals, and then invite their creativity to meet those objectives. It also tends to be a role or style that facilitates communication between levels of work, so between line staff, middle management, organizational leadership, and then maybe also that would be kind of the vertical levels, and then maybe also horizontally might communicate outside to other departments or other roles within the organization. So there's this vision of the whole organization that's taken into account in this model. There's also a consultant model where a leader might have a particular set of roles and tasks, and their kind of orientation is to advise and interpret events to their constituents or stakeholders, whether that be the organizational agency leadership, client groups, or other workers. The tendency in this model is to make recommendations. There also might be projects that are undertaken or assignments that are delegated, so this sort of episodic involvement. And this consultant model of leadership provides kind of problem solver focus and also presents an expert orientation. So someone who is seen as having a particular set of skills and abilities that are congruent with the tasks and the mission of the role. There's also another model, which I don't know that I've ever really seen this described in the literature, and I'm just calling it a lieutenant because I think this is the way that a lot of people sometimes expect to carry out a leadership role, as kind of a middle manager role, where activities are directed from above, and there's more of this management or facilitator orientation. Like, your job is to help the other staff complete the tasks set by management. It tends to be a directive orientation to the tasks, and accountability is in the manager, which can then play out in some difficult ways when managers feel like they're responsible and then might become punitive or adversarial with their direct reports. So that could be kind of problematic. But I think it's a model that a lot of people kind of fall into if we're not careful. I think this is a model that's particularly difficult for social work just because of the way our values and orientation um, lead us into our work. Across models, what is generally desired in leadership, so these are kind of factors um, or qualities in leaders that tend to work well. They, first of all, you want leadership that reflects the culture of the organization and is therefore aligned with the mission and vision and the modus operandi, if you will, of the organization. Also, to have a perspective that balances the internal and external focus of activities simultaneously. So, in other words, there's sort of a looking at the agency and the work that we're trying to do, but also maybe the relationships we have with other stakeholders externally, whether that be, at the policy level and how our changes in rules and funding going to impact our clients, or maybe looking at the funding environment and how philanthropy has changed in the economy, those kinds of things. So looking for, again, this idea of alignment between what we're doing internally and the levels of support or structures that we rely on externally, as well as the people that we're working on behalf of or in the service of. So keeping an eye on that tension and striving to balance that. Also, effective leaders communicate to both superiors and subordinates, so they see their role as sort of bringing better relationship between the activities of both of those groups. So again, there should be cohesion in the organization or the agency around what the superiors are trying to have happen and what the subordinates are carrying out on the line. Also, effective leaders are able to articulate accomplishments and also identify opportunities, which also could be seen as problems or challenges. So being kind of proactive or thinking ahead, and also respecting the input from line staff to identify opportunities for growth or change that are occurring. Also, that effective leaders are able to interpret needs up and down the chain of command. So when you think about organizational or agencies operating vertically between people with different levels of authority within the institution and different roles, and also horizontally in terms of across tasks and maybe programs, you want a leader who understands the relationships between these different levels and is effective at interpreting their perspective and their needs and their input to the other groups. And an effective leader will, of course, recognize the interdependence of all of these activities and relationships. And again, keeping an eye on the whole structure and the whole set of tasks, basically having a holistic perspective. Social workers tend to adopt leadership roles in a wide variety of ways. Certainly there are social workers who become social work department managers or supervisors or social work leaders within an institution. Certainly we would like to see those people well trained in social work and having an appropriate degree for their level of responsibility, and also being appropriately licensed and credentialed by whatever board or licensing authority exists in that setting. And we'd also like to see people in that role also ascribing to things like the NASW codes of ethics and standards, particularly because that's a kind of a position that puts a flag in the ground around excellent social work practice, and often is in charge of setting standards and expectations for social work practice in an agency. Social workers also might become leaders or managers of a certain program or specialty practice area where it might not be exclusive to social work practice, but perhaps include interdisciplinary specialists, maybe running a community mental health clinic or a palliative care program, or having a leadership position in a nursing home setting where they might supervise physical therapists, occupational therapists, nutritionists, and others. So there, again, social work practice standards, of course, would inform the activities of that leader, but they might not be applicable broadly to the other members of the team. So the social work manager would need to kind of figure out how to provide effective leadership to those groups, and clinical supervision, as we understand as a social work group, might or might not pertain. Also, social workers can make excellent leaders at the organizational level, again, not specific to social work practice, but contributing to overarching planning and accountability for the agency or the organization. As an example, in the hospital that I worked at, there was a social worker who became a vice president for patient care and utilized his abilities from that vantage point. And then another way that social workers provide leadership in many agencies is through informal channels. And we do that by gaining the respect and the ability to influence others by just being effective in our work and being respectful and yielding results that benefit our clients and the agency. We also tend to accumulate social capital. We know people, we know how to use backdoor phone numbers, how to find people, to leverage resources and skills. And we also have knowledge and skill that is respected by others and is brought to bear at critical moments. There's probably others that you can think of, but those are just a few that give you, again, a very quick overview of the depth and breadth of social work roles in leadership positions. One thing we want to be careful about when we're a leader is where we're leading people, and maybe it's important to go over the cliff, but usually we would try and avoid that. And again, an effective leader would hopefully see that there's a cliff coming and help to divert things to prevent unnecessary losses of livings and others. I think sometimes it's easy in organizations for everybody to be headed off in the same direction without really thinking about it, and to pause and ask who is leading this and where are we trying to go, what are we trying to accomplish, can be very effective kind of reorientation questions that can get everybody back on track. There are specific challenges, and especially in health, disabilities, and aging these days, to those in leadership. We are often working in environments that are chaotic, and there's a lot happening day to day, a lot of coming and going of clients, complex needs, multi-problem situations, and also rapidly changing environments with, for example, the rules and regulations that guide practice in healthcare or in with the disabled, using state and federal programs, those kinds of things. So we're constantly pressured to adapt. There can also be problems with a lack of clarity about the vision or expectations for what we're trying to do, what the leader is supposed to be trying to achieve or lead their group to do. There's often competing expectations, do more with less resources to meet the needs of different constituency groups who might have specific requests or needs that sometimes at least feel like they're in competition. There can also be tensions between leadership and line staff if the people on the front line don't understand why or how or what they're being expected to do, if they have expectations that differ from those of leadership, or if leadership changes direction and doesn't communicate that to line staff. All of these can be problems that create huge tensions and can really confound the work environment. There can also be problems when there's lack of clarity around the social work role and knowledge base and purpose, and this was mentioned in a couple of the articles that we read for this week, that there's kind of a growing concern among social workers in particular that other disciplines are taking over some of our tasks, or it is being deprofessionalized and that people who don't have social work training or credentials are being given leadership positions around, for example, psychosocial care in nursing homes sometimes. Um, there's a dilution of roles that we've talked about in other classes this semester. For example, titles like case management, care navigator that, if you read the job description, look very much like social work, but are being made available to people from other disciplines, including nursing and other things. So I think we have a real challenge to communicate to our colleagues what is our social work role, and then also we need to clarify it amongst ourselves and to be prepared to assert that our particular skills and knowledge and attitudes, the value base and the professional practice perspective that we bring is in fact specific to social work and has value. Social workers who are leaders hopefully operate with a set of skills and perspectives that reflect our professional social work knowledge base, skills, and practice standards. Those include operating from the values that we hold as a profession, using systems, perspectives, and awareness that again is core to our training as social workers to understand the interrelationships between things and the impact that one element might have on another within the system. Also, social workers bring our multidimensional assessment and intervention strategies, and this can be a wonderful perspective to bring to leadership, where you're noticing the complexity of dynamics and able to identify where strengths and vulnerabilities lie, and how to leverage strengths in the system to address areas where there might be greater need or vulnerability. Also, social workers tend to prefer a participatory style and a focus on inclusion, so to engage others in problem-solving efforts and to strengthen the capacity of individuals to participate in problem-solving efforts. These are wonderful social work skills that are very adaptable to leadership and have a lot to offer. There's been some studies in the past from social work leaders looking at 5 common elements in effective leadership. And they describe, so these are things that social workers who were leaders felt was helpful to them in being effective leaders. And number one was proaction. So not waiting for problems to arise, but trying to anticipate them and get some plans in place and to try and anticipate what's likely to help the situation or to plan for the future. They also describe number 2 that being values and ethics driven in their practice or in their leadership allows them, kind of a grounding from which to make decisions and to evaluate options. Number 3, empowerment. So helping others to be effective in their roles and to be leaders within their own context perhaps, and to contribute to problem-solving efforts of the agency or the group. Also, number 4, having a vision for what's possible, what a good example would look like, what potentials exist out there is a wonderful element in successful leadership too. And then also number 5, last but not least, is the ability to communicate effectively and frequently in order to create cohesion between all the levels of operations in the agency or department or organization. So some strategies for social work leaders is to align our activities with the mission of the agency or the organization. Usually that revolves around a certain set of tasks or a certain population that we're trying to assist with our work. Also to promote professionalism, as we mentioned earlier, to talk about the role of social work, the particular knowledge base and skill sets that social workers bring to the table, and to encourage social workers to operate in a professional manner so that that can be recognized by others. Also to accurately assess and plan for the future, to really keep an eye out for what's coming down the road, and to try not to be shocked or surprised by that, but just to expect change and new demands and to sort of build that into your workaday life. Also, to manage internal structures and operations in response to external demands and expectations. So again, this kind of multiple perspectives at the same time so that we can balance the needs of the operations of our agency with those of the marketplace, um, competition, and also new innovations. And kind of going along with this too is to see it as part of the leadership role to exert influence on both those internal and external environments. So within our own agency, to strive to be effective and on the cutting edge, and then also to communicate to the external environment what we're doing and how that adds value to the community and manages the set of tasks that we've been assigned to do. So strategies that support people being effective in leadership positions are, they seem pretty simple, but actually, depending on the culture of the organization, can be very challenging to acquire. So first and foremost is to get social work leaders at a place where they're able to participate in organizational level planning. So that kind of big picture planning that can happen. It does happen frequently in organizations. In other words, getting a seat at the table so that input can be offered and that we can hear what kinds of issues are being talked about so we can understand the implications for our social work practice. Also, when people have control over the nature of the work of social work and departmental activities, that enhances effective leadership. It's very difficult. In fact, it's quite a bind to have a lot of responsibility and very little control. So especially in the area of social work practice, we would like to see organizations supporting social work leadership and professional integrity. It's also helpful when decision-making authority is explicit. That's true whether you have a lot of decision-making authority as a leader or do not, but just to be very clear about what you get to have a say in and what you don't, just helps people be organized in their work and also to put their energies where it's going to make the most difference, and also to make informed decisions about their practice. And again, having clear expectations and open communication always helps people when you know what you're supposed to do and you're given the authority to do it and you communicate effectively what it is that you've done and what you plan. That's always going to help for smooth operations. So there are some concerns in the general marketplace in health, disabilities, and aging right now. And those concerns include things like the erosion of the social work role, as we talked about a little bit earlier, that social workers are often directed by non-social workers. So you might have a nurse manager in your program or maybe a psychologist who supervises you. What does that mean for social work practice? Are we becoming more like some of our other discipline colleagues, or is our professional expertise not understood by others? This contributes to a blurred expectations and performance expectations with other disciplines, for example, nurses and paraprofessionals. And then this tends to compromise our professional autonomy. And if you look at the issues bulleted above, you can kind of see how that contributes to a generalized lack of clarity about what it is that we're bringing as a profession, to some of the terminology that we use. We're interested in being supportive and helpful, which is true, but if we can get into the habit of thinking more specifically about the things that we're doing with our clients, and of course the importance of evaluation, just helps us demonstrate our value add to organizations. Also, there's a lot of concern that as financial pressures increase, we have to do more with less, that as we adapt to those demands, the squeaky wheel gets the grease. So as a lot of wheels start squeaking, we wind up focusing our attentions on certain sets of tasks and never able to quite get to the others that might be more satisfying for us as workers, but also be very helpful to our clients. For example, in hospital settings where social workers are more and more asked to assist with complex discharge planning or financial arrangements, as a condition of discharge, they're not able to get to those supportive counseling activities that clients also need in order to adapt to difficult circumstances or plan for the next phase of their care, for example. And also, a lot of other disciplines lay claim to being supportive and helpful to people, and tends to kind of contribute to this general undervaluation of our work. And so again, I think the challenge is on us as social workers to learn to articulate what it is we do and what our value add is to the organization. In a lot of ways, we spend a lot of energy trying to minimize our use of jargon and so forth, when in fact, I think there are times when throwing around some terms could actually serve us pretty well. Some of the skills that make a difference in leadership, so these are good skills to cultivate if you're going to be a leader. The ability to negotiate, and again, some neutrality and ability to hear all sides is useful there. Collaboration, which means recognizing what you bring to contribute to the joint effort, and then also recognizing what else is out there that you can call upon to fill in to achieve more than we might be able to do on our own. The ability to claim some power and authority and influence, and to wield that with intention and skill is a huge benefit to leadership. If you can spend your life developing those skills, you'll be sitting pretty, as it were. Also, innovation and creativity, so being able to think outside the box, be able to think down the road, being able to rearrange the puzzle pieces to create a more useful strategy. Those are all really wonderful skills. Being able to be flexible and responsive to organizational change is going to first just save you a lot of grief, but also make you a kind of a key player in the organization. That kind of modeling and that capacity to flex with changing demands is highly valued by organizations. There's also a real role for specialization or grounded expertise, really knowing what you're talking about, whether that's about social work, whether that's about some specialty practice area like mental health or cancer care or whatever, or working with the elderly. But that idea that as a leader or manager, you bring grounded expertise that contributes to your knowledge of the situation and your ability to lead in that area. And then again, the capacity to be proactive and to look ahead and to act before the crisis occurs is also very helpful. The only other comment that I'd like to make is that that one article that we read, the Mizrahi and Berger article, I feel like I kind of lived through that time in the mid-90s when they were doing their study, and I just want to say that I think things evolved. That was a difficult time, but things are very different in the current marketplace, in part because I think social work leaders have learned how to flex and respond to dynamic care environments. So I just wanted to let you know that I think things look better out there than that article suggests, although there's certainly some very valuable points in there yet. So anyway, that's my thoughts for today, and good luck with your group work, and we can check in on any questions that you might have when we meet next week. Thanks.